Namaste. Today is National Ayurveda Day. So every days are observed to raise the awareness among the society regarding the value of that particular theme chosen for the day. And being National Ayurveda Day, I think it's appropriate to discuss about the current issues in Ayurveda. So, my first question is Ayurveda. I feel that Ayurveda is not genuinely practiced as Ayurveda today. What do you think about it?
Yeah, definitely. It's not practiced in the way it is meant to be. That we can understand with two things. What Ayurveda advocates is prayoga and prayojana. So, how the application is, what is the yukti behind, what is the scientific justification behind application, and what is the objective. Means Ayurvedic objective is dhatu samya kriya cha ukta tantrasya asya prayojana. So finally to achieve health. So what is being practiced today is not to achieve health but to maintain glucose level or make the lab parameters normal. So such practice is seen everywhere, and as well as the prayoga. Always agamena upayojyani bheshajani vichakshanehi. So it is always you need to follow the science when you apply a medicine. Tadeva yuktam bheshajyam eda arogyaya pragalpayet. So it should be for achieving, to reverse the cause mechanism and to achieve health. Also it is also everywhere it is mentioned that jnana purvakam hi karmanam samarambham prashamsanti kushalaha. So always it should be based on this scientific knowledge. So you should be knowing the roga status, rogi status, how to apply the principles behind application, how to choose a medicine, how to choose the food and medicated water according to the patient status, and its application also. So yukti for application, all these are to be known before you start a treatment. Jnana purvakam hi karmanam samarambham prasamsanti kusalaha. So these are not practiced nowadays. So prayoga and prayojana, both are completely distorted. So nowadays what we see around is not real Ayurveda or Ayurveda as it is. What's your opinion?
You mean to say that Ayurveda is not practiced today as Ayurvedic science-based medicine?
Yeah.
What we find around is different kind of application led by intuitions, self and shared experiences with different medications and treatments.
Exactly.
Which they claim my 40 years experience, 30 years experience. I have been seeing this. Who are you to question me? That is how the professors are. Like, what they believe more is how they did all these years, and they were not caring to rethink, unlearn and relearn from these experiences. So do you think any value is there for such experiences which are blindly led by the previous experiences?
So these are experiences of these so-called legends or professors and
so-called considered legends.
Considered legends.
Experience-based medicine and not science-based medicine.
So what science advocates is whatever you are doing, it should be jnana purvakam, and always it should be for attaining health, to reverse cause mechanism. That is not happening nowadays. So it cannot be considered, it cannot be counted as Ayurvedic treatment.
So whatever we find today is tradition-based medicine. Tradition means a set of beliefs, ideas and practices which are being blindly continued for generations. Next, experience-based medicine. Self and shared experiences with different Ayurveda medications and treatments. I have been doing all this all these years, so I will continue doing this. And last but not the least, eminence-based medicine. I have got this much awards. I am a very senior person. I am rich in experience. See, my hair is grey, so what I am telling is correct. Such kind of illogical, dangerously illogical, because it's a medical practice which is intended to be practiced as science-based medicine. What is science? Science means knowledge, scientia, knowledge. Ayurveda is a deterministic science, science of determinism. So instead of following that science, innate logics, what, how, why, when, where, everything, probing techniques, methods, logics, everything explained in the science. By deviating from all of that, staying in a comfort zone, by believing in self blind experiences and legendary awards what they are getting, and following that and educating that is what is happening today.
Yeah.
So everything as it is deviated from the science,
Yeah.
as it is deviated from the science, originally it is science.
It is,
it
they are
is-
doing this to protect their ignorance. Actually, it is.
Exactly,
Yeah.
exactly.
To rogamado pariksheta tadanandaram aushadam. So there is a sequence how to examine a patient, then
Right.
how to examine a peshaja, and tadak karma pishak paschat jnana purvam. Always it should be based on the science.
Science-based medicine.
Science-based medicine.
Karma means practice. So it is evidence-based practice, but the evidence is primarily led by logics of the science of Ayurveda.
Yeah,
So it is
everything.
science-based.
Means even when we select unlike Western medical system, when we select a medicine, it should be anayacha matrayacha yuktam asmin vyatho edavandam dosham apagashat upashamyadi va. Also, how the purusha is, what is the status of strength of the
Personal
strength
environment.
stage, and status of the patient also is to be considered. So everything is to be considered, and the application should be perfect, because we are dealing with lives of people.
So
So
do you
it is-
not think the intelligence of physician needs to be standardized, led by the principles of science?
Exactly. As the science advocates, whatever you do, it should be based on the science. Science is cause-effect relationship mentioned in the science, the logics for application, logics to identify in the patient, and how to apply all this. Once you select the medicine also, or food, medicated water regimen, etc., according to the patient status, when you are selecting, how to apply also, everything is scientific from first to last. So if it is not standardized, whatever is being done, everything is wrong.
So the main problem is that they are following Western methodology.
Yeah.
Western medicine is probabilistic medicine.
Yeah.
It is not originally science-based medicine.
They are
It is
trying to make.
biostatistics-led medicine. Whatever the research they claim to be, which is happening in microbiology and whatever other allied fields, finally what is being administered is led by biostatistical trial and error reports of probability of what you call the benefit risk ratio.
Yeah.
That is what it is being decided. But unfortunately, Ayurvedic medicine currently is blindly following the probabilistic medicinal research approach of Western medicine, which is suicidal,
Yeah.
which is nothing less than suicidal. We
Yeah.
are killing ourselves by doing this kind of erroneous research, following the even Western medicine does not have any way to prove that their drugs are working. So they want some kind of evidence to substantiate what they are doing. As they do not have innate logics, their science is not deterministic, they do not have a well established theorems, principles regarding diagnosis and treatment. So finally they are going for unknown compound trial and error, for which they need to justify by some evidences of incomplete evidences of uncertain evidences of temporary evidences of benefit risk ratio, which they are settling in and shouting out as evidence based medicine.
They are fabricating an evidence and saying that, and they are trying to make it as science. So it's not science based.
It is biostatistical medicine. It
yeah.
is biostatistical medicine. But Ayurveda originally being science based, why do we need to deviate from our own independence, our own identity, our own technical brilliant infrastructure, and going out behind something which is imperfect, full of lacuna, full of uncertainty, full of confusions, full of chaos, full of trade? We are going behind something which is uncertain. There is no clarity, no confirmation, no certainty in the application of drugs of Western medicine. But that is their problem. Let's keep it apart. We are coming back to our topic. But the main problem which we feel today is that unless and until Ayurveda follows its own roots, its own brilliant roots and guidance maps, it is not going to be practiced as Ayurveda. And do you not think that this medicine in that disease approach, once a patient comes and tells a symptom, Amla Pitta will be diagnosed. acidity will be misdiagnosed
Yeah.
as amla pitta, and some medication. I am having headache also. Again, some medication will be prescribed. Do you not think the prescriptions are so
So
irrational?
what is being followed today is whatever is mentioned in respective chapters, based on those symptoms, if is mentioned, so many medicines are mentioned, all those medicines are uh, prescribed or administered to that patient. They are not checking the patient status, how the disease originated,
Yeah.
and what is the status of the dravya or bheshaja which they are selecting, whether they are virya viruddha or not. So nothing is taken into consideration, and blind administration of so many medicines. If you see a prescription, you can see almost
12 to
around
16.
more than 10 medicines which are blindly mixed, that can result in any sort of fatal consequence. But as they are acting naturally, it's not causing much harm in the present scenario, because they are suppressing their symptoms with Western drugs along with so many other things. They are doing that, so impact is not that much happening. Once they stop, or when at a time when their prime age is gone, and when they are not following wholesome food, everything will manifest together and it becomes fatal.
So this polytherapy is a crime, and our science strictly advocates nacha kriya sangarohita. It's not appropriate to mix different kinds of treatments led by different logics, contradictory logics, different principles applied together in the patient, because Ayurveda is specifically precision oriented medicine. Tasmin kale tat adhigaranam asadya tam yuktimartham cha tam abhipretya yat kurvanti tat karma, which means the medicine has to be
Specific.
administered in the right virya, the right potency, in the right target. It should be focusing upon the right target when you are choosing medicine. And tasmin kale, it should be appropriately administered in the right state and stage of the patient. Tat adhigaranam asadya. Medicine will reach its own adhigarana, target of action, if you are administering it logically, if you are choosing it and administering it logically. All these yukti, artha, science-based reasoning. Science means Ayurvedic science-based logical reasoning is considered to be the golden standard of clinical decisions in Ayurveda. Shastra sahita tarko sadhananam. Ayurveda specifically says the golden standard of clinical decision making is Shastra sahita tarka, science led inbuilt logical reasoning. So in place of that, there is no science, no reasoning, only personal
Blind
intuitions.
application.
So it's very dangerous, no?
Not only Kriya Sankara, it's done for long period also.
Yeah, it's
Yeah.
like for months.
It's not,
and online
in
also.
science it is mentioned that saptahena kriya labhe guna labhe kriya manyam prayojyet.
Right.
We can maximum wait only up to 7 days. So how much fast it is. But without considering any of these things, patients are asked to consume medicines for more than 3 months, or after every year you can come for review and have the same sort of Kriya Sankara again and again. So such unethical, unprofessional management is happening, and that can result in so many immune disorders like
metabolic,
autoimmune conditions, cancers, because all these are producing toxic metabolites in the body. So these toxic metabolites, in course of time, it can result in Vishamadhadu, it can result in abnormal immune responses, it can result in abnormal, even the phenotype of the cells can get changed and can result in malignant changes. So all these are detrimental, not only to the public, it is detrimental to the science also.
So there is no clinical audit in Ayurveda.
Yeah.
Anybody can prescribe anything as Ayurvedic medicine. I am surprised to see certain people, certain patients telling, doctor, I have been on this doctor's treatment. He might be a qualified doctor, but there is no prescription. Doctor has given me some medications in a cover, in a pouch. I don't know the names, but the doctor told that he himself is preparing it. How illegal and how wrong it is, how criminal it is to administer medication by a qualified doctor without prescription, and nobody cares. Even the patients do not know the serious detrimental harm of not knowing about medicine and receiving it. So such kind of, how can we regulate such kind of irrational prescribing? Only we can regulate it by clinical audit. So clinical audit is possible only when there are standards, scientific standards to evaluate, to compare whether something is rational or irrational, diagnosis is correct, or the particular treatment in particular patient is correct. We should have reference standards. That currently it is not having. SBBA we have developed, so that is a main milestone.
Shastrartha Jnana is indispensable.
Exactly.
So to make standards, we need to know the exact objectives of the Shastra.
Right.
Not just the meanings of the Shastra. Shastrartha
Exactly.
means it's not the meanings of the Shastra. Scientific practical knowledge is Shastrartha Jnana. So without that, when we are taught from first year, when we are not having this Shastrartha Jnana, when we become physicians, we will not be able to standardize whatever we are doing. So our diagnosis will not be standardized. Rogi assessment will not be standardized.
Right.
Everything is exactly in the scientific manner what is mentioned in the science. How to assess a rogi. So rogam nidana pragrupa lakshana upashya. You cannot identify a patient as two different status or as two different stages of the disease or with two different strength in that patient itself. So everything is standardized in the science, but Shastrartha is lacking, and standardized diagnosis, standardized treatment, standardized application is not there in the current scenario. That is the basic cause for, or clinical audit is not there. That is why this much irrational practice is happening in the society.
Unlike the diagnosis of disease in modern medicine, in Ayurveda we have diagnosis of the patient, which is very important in the unique internal environment of the patient. Patient has to be diagnosed by standardized methods, standardized logic, standardized tools, which are transparent, reproducible. So what needs to be transparent? It is not data in Ayurveda. It is the innate logics of science which are meant to be transparent, which should explain why, what, when, where, what's happening here, why this logic, what you're going to do in your treatment, and how it is going to be reversed. And cause, mechanism, effect relationship is to be standardized. This is what is being...
and Bheshaja Prabhava
Yeah, the Bheshaja Prabhava Tattva. This is what we have done. We have developed in SBBA, and we are educating doctors regarding the rational standards of SBBA, how we can go for.
That is how it is exactly to be matched. And once we are identifying the Vyadhi Prabhava Tattva and Bheshaja Prabhava Tattva, exactly opposite to that, the treatment what is mentioned in the science, and if we know the application, Pratipatti Jnana also if we know, then that is the perfect way of managing a disease.
In a patient.
In a patient.
So this kind of approach is to emerge, to emerge scientific Ayurveda, to establish scientific Ayurveda globally. Other nations will attend Ayurveda in India only when Ayurveda is practiced as intended Ayurvedic science-based medicine. And policy makers are unaware of the scientific Ayurveda standards, what we have done, our work in SBBA. They are unaware of, or they are just denying to understand, is what I feel, because we have submitted this proposal long before itself, explaining what the intentions of our works are, explaining what the methodologies are. So if they are attentive to these proposals, these crucial proposals, which will change, which will cause a revolution in current Ayurvedic practice, current Ayurvedic education, clinical research, everything, if they are attending, definitely the future of nation will be different. Not only that future of Ayurveda will be different, but also the future of healthcare in the nation will be different, because national economy will improve by health of people. The cost of healthcare will reduce tremendously. What do you think about it?
This is happening because of two reasons. One, this Shastrartha Jnana is not there. Application knowledge or practical knowledge of the science is not known.
Yeah.
And when we try to explain to them, they will be thinking that we have already learned all these things.
Yeah.
That happened, no.
Very unfortunate.
And the second thing, they are trying to update it with Western research methodology and with Western scientific methods.
Biostatistical. Better don't call it scientific. It's biostatistical
they are
methodology.
fabricating a science. They are having inductive reasoning. We are having deductive. We have a science and we know everything and we are applying the treatment and we are getting a result. They are applying blindly without knowing the patient, without knowing the disease, without knowing the disease status, without knowing what they are applying, and without knowing the application also. When they are applying, what the result they are getting in a population. In one population, they are generalizing. When they are suppressing a mechanism and getting some benefits out of more than risks. So it's not reversing a disease, and such benefits are considered as science in Western medical system or Western drug system. So when Ayurvedic policy makers are following those systems to update Ayurveda, we are again losing our integrity and our scientific
our footing,
our
basis,
our basement itself we are losing.
Yeah.
So
we will not reach anywhere, and it is like a very.
So once SBEBA or science-based evidence-based Ayurveda is adopted in the national health system, its fragmented dosage approach and immediate results. So in acute conditions, when we get immediate results, we don't have any tension of this pandemic or other infective conditions, and patients will not escalate to chronic diseases.
Right.
Number of surgeries will decrease, number of emergencies will decrease. So everything can be prevented once scientific Ayurveda sets in.
So it is like now the people are on 20 pills, 10 to 20 pills. Once they approach SBBA with the innate logical infrastructure and clinical algorithm patterns of SBEBA, it is possible to cut down 20 drugs to 2 medications, and that 2 medications can be cut down after we resolve the issue and stabilize health of the patient. So in most of the patients do not remain as patients in the after the treatment phase, and they are able to avoid the necessity of medications for the rest of the life. And during treatment, we are treating by OMSD, one medicine scientific diet approach. We are giving Ayurveda medications not in bulks. Nowadays, people carry bags to Ayurveda pharmacies to get medicines. So instead of that, we are giving medications 1 or 2 maximum fragmented dosages. Mostly 1 or 2 tablets will be enough. Kashayam tablets will be enough to heal their acute conditions.
5 to 6 rupees.
Such a kind of health economy is able to be maintained. So imagine how much reduction in the cost for healthcare of people, and that too highly scientific, amazingly scientific. What is this scientific? Scientific means it should be logical, it should be rational. You should be able to explain what the condition is, what is going on inside the body of the patient. It should be explained. What you are doing should be working inside. You should be able to explain the work, and you should be able to achieve the intended effect.
And objective of the treatment should be that also should be ethical.
Healing. That
is only ethical. In a patient, when we are treating and reversing only, then only it becomes ethical. Otherwise, it is cheating only.
Masking, blocking, suppressing, altering are not our ways. Honorable Prime Minister of India, actually, we would like to tell that this is an entirely different protocol in comparison to conventional Ayurveda. So, we would like to humbly invite your attention to what we are speaking here. This is very crucial, just like what respected Honorable Prime Minister has said, has done in demonetization. Exactly same kind of impact is going to happen in healthcare also by this implementation of this crucial project of science-based, evidence-based Ayurveda, and also finally integrated medicine, integrating modern medicine with Ayurveda.
So entirely, exactly opposite ways.
Yeah.
We are following.
Yeah.
So it cannot be integrated at any cost. So in case of surgical necessity if arises, they can do surgery and afterwards come back to Ayurvedic science and do the needful. In a cancer patient, you can do surgery and afterwards we can go for. It's not like mixing up one paracetamol and taking
controlling disease and coming back to
coming back.
Ayurveda. Just like this, so many blunders are being done in Ayurveda today.
And it's highly successful what they are claiming is.
And in multiple drugs, Ayurveda medications from one side, Western drugs from other side. Not even independent research has happened regarding multiple pills in modern medicine. What is happening? Nobody knows. In Ayurveda, multiple medications, today's prescriptions, nobody will happen. I mean, nobody knows what will happen. So if you combine both and administer, what will be the detrimental outcome of such a kind of prescription? There is no studies. There is no such. Even studying it is foolish because science says not to mix. Nacha kriya sangarohida. You should not be doing mixed therapies. You should
and objectives are different also.
Yeah, objectives
Our objective
are
is Dhatu Samya Kriya.
We are learning modern pharmacology, so we know how their drugs are working by blocking, masking, suppressing, supplementing. So every medical system will get utmost value when it is practiced independently and thereby exploiting the fullest potential of concerned system. So integration is to happen in the human body and not between different systems. When a person is having different diseases, the different pathologies are to be integrated within the human body and minimal medication to resolve different issues simultaneously are to be administered. And this is possible only by science-based medicine of Ayurveda. That is why SBB is very crucial. So this unprofessional and substandard education.
Yeah.
So that has to end, right?
Yeah.
In BA.
So from education from first year itself, students are taught
wrongly regarding
wrongly
fundamental concepts.
From the fundamental, they will be learning so many grammar, Raghu Siddhanta Kaumudi, grammar,
Sanskrit grammar,
Raghu Kumara Sambhava, etc. When they are learning, they are totally deviated from science, Ayurvedic science.
Right.
If they are taught with Ayurvedic slokas, what the Sandhi is, what the Samasa is, and what the scientific meaning is. So, Vayu Pitta Kapas Chidi Trayo Dosha Samasataha Vikrida Avikrida Deham Krandi Te Vartindicha. From that, if they start, they will be only thinking in scientific manner and also Padartha Vijnana. In the first year itself, we need to know the laws of nature of all the living beings or nature in life processes. We need to know the laws of nature, only that much. For that, we are in first year, it is being taught as one subject, which they have to give their 1.5 years for Padartha Vijnana. Then again, they are totally deviated from the science. And when they come to second professional, they will be learning Roga Nidana as lab diagnosis, Dravya Guna as
medicinal botany,
and final year they will be just clinical application based on certain teachers' experiences. And Kriya Sankara is
and
also
Western
seen.
medicine is being prescribed in many Ayurveda colleges.
And
is it not? Is it a fair way to practice
it is
Western medicine by Ayurveda doctors?
Criminal only. So these are the basic problems with which on this National Ayurveda Day we should reveal all these things, and we should be unbiased in our thinking. Then only our science will prosper as well as it will serve the humanity.
So with this message, our aim of making this presentation is, first of all, we should have the consciousness of what is intended to be learned, achieved in Ayurveda by Ayurveda professionals. First of all, self-consciousness is important. Before we try to propagate the consciousness of a science before the society, Ayurveda doctors themselves should have self-consciousness regarding what is right, what is wrong, what is fair, what is unfair in the practice, in the research, in education of this science. That is why we humbly did this presentation. It's
motto.
not meant to hurt any feelings or to what you call blindly blame or criticize any organization or government or anything. It is just a blatant exposition of the reality, current existing pathetic scenario of Ayurveda, and we sincerely pray, Lord Dhanvantari, that a change will happen together if we are working together. Let's pray for that. Let's work sincerely for the science, and let us emerge as scientific professionals, end nonsense and practice science in Ayurveda. Jai Hind.
Jai Hind.